Good morning, distinguished participants, to this August gathering. On behalf of the Honorable Coordinating Minister of Health and Social Welfare, Professor Mohammed Alupati, and the National Coordinator of the Sector-Wide Approach Coordination Office, Dr. Muntaka Umar Sadiq, I want to welcome you all to this capacity building that is termed Nigerian Health Sector Renewal Investment Initiative, Leadership, Health System Strengthening, and Planning Capacity Building Workshop for Health Managers in the Nigerian health space. We are approaching the 2026 Annual Operational Plan timelines, and it is also understood that for us to improve the health outcomes in Nigeria, we cannot afford to be doing the same things over and over again. 2026 will be the first full year for us to test our implementation of the laudable projects, laudable initiatives that Honorable Coordinating Minister has brought into our country, such as the HOP project, the MAMI, among others. While we agree and acknowledge that reforms take time, but we have to demonstrate in 2026 the fidelity of these approaches to show how they can be transformative to our health system in Nigeria. 2026 is the year that stands between us and the general elections that will come in 2027. And while our political actors, our leaders, the political actors, would largely be focused on the elections, technical actors within the Nigerian health space must have and endure to continue developing and providing the necessary healthcare delivery that Nigerians badly need. Last year, we started demonstrating what it means to bring ourselves together as a country, all leaders from state, federal, development partners, to work towards having 2025 annual operational plan across 36 states and FCT. This is the first time in the history of our country that we reached this milestone. Against the 2026 AOP, we now need to demonstrate and to consolidate on the gains that we've made in the years against 2025 annual operational plan. And to better serve Nigerian people, we feel the 2026 annual operational plan will have a theme that we want to develop a plan that is rational, realistic, pragmatic, and comprehensive enough, and to make sure that that plan aligns with Nigerian health, with our health sector budgets. Last year, we collectively worked towards getting the plans developed across the 36 states and FCT, despite the challenges. We noted that a number of the states do not have, before then, technical capacity, whether from partners, also to make sure that they have their plans. And we also note that some of the partners, some of the states actually have their plans, but it's not timely enough to inform their budgets. While in some states, the plans are only fragmented to either an agency or just the state, but it's not comprehensive enough of all that we are doing as a country, as a state, across facilities, local government, and all that our partners are doing. But with this, we work together to make sure that we bridge the gap in technical ability, technical assistance to have those plans developed across all the states. And we've started to make sure to see that some states have their plans early enough to inform part of their budgets. While this is a milestone, but we also noted the capacity gap, that we are unable to use data to inform decision making, to inform what we prioritize in our plans, especially with some of the initiatives that Honorable Coordinating Minister and their excellencies, the governors, have agreed to. We understood clearly the attainment of a revamped annual operational plan would be a gradual process, requiring renewed political willingness and leadership from all actors. And that is why this year we're trying to start and consolidate on our journey. Last year, when we started the state strategic engagement in the sector-wide approach, We noted from the states as part of their feedback that there are important elements that states need to consolidate upon for them to perfectly participate in this reform that our country is going through. Some of those elements include strengthening execution capacity at the front line, setting up performance dialogue sessions both at subnational and national, and to make sure that states have institutional capacity to develop timely, quality, comprehensive plans. To get the states to do this, there are a couple of things that need to happen, some of which include strengthening the state's persons, the key actors, you, the program managers and mid-level managers, to strengthen your analytical capacity, strengthen your ability and understanding of health systems, systems thinking, problem solving, use of data to inform decision making, and strengthening our data generation systems and M&E processes, to mention but few. So with that, this year, we're starting to set up that platform and ensure that we need to course correct on our implementation to make sure we build the foundations of quality plans. With this, with the network and collaboration with our state governments, state governments, Honorable Commissioners of Health had nominated 3 brilliant program managers that we had interacted with over the last 1 week or so. And we've gone through these processes, including the renewed planning tool that we've developed as a country. This week, in your state, these program managers are cascading this training to an army of program managers and emerging leaders within the health sector. It is our hope that you as program managers will take on this valuable insight and learnings that we will provide to you to inform course correction on implementation of your programs, and also to support the local governments in their month-on-month performance dialogue as they move on. Together, if we improve our planning and improve our data use for decision making through the performance dialogue, we will continue to iterate our implementation to make sure that it is aligning with the priorities that we've all been yearning to see in our health sector. The AOP roadmap had already been shared by the Department of Health Planning, Research and Statistics of the Federal Ministry of Health and Social Welfare. And it is expected that from now to certain time, you as a state will identify and quickly do a review of your 2025 annual operational plans, the progress made, the implementation status, and or conduct your joint annual review. And the DP, and then once that is done, it is expected that Honorable Commissioners will lead the states in course correcting on what is left for 2025 to make sure we are aligning our resources to achieve some of the indicators set out in either the HOPE, the PHC Leadership Challenge, or many other initiatives. And secondly, to make sure that we prioritize what are those areas we need to focus on to make sure that we make an accelerated progress in 2026. With those priorities set out, the program officers in each department would be expected to sit together with your stakeholders, be it implementing partners, community leaders, some facility managers, to x-ray and set baselines on those priorities that the Honorable Commissioners will lead you to agree upon. And on all those priorities, we would expect you to use the learnings that you will take from here to work collaboratively with your teams to define what are the problems that had limited your progress on those indicators, and then define your interventions and activities and have them in your annual operational plan that is now a web-based application. It is expected that from that time, the directors will sit, review those plans, within their directorates, and then those plans also will be reviewed at agency level before you move to the state technical AOP review meetings. That way, our AOP for 2026 would have gone through multiple layers of refinement to make sure that it is really focused on those items and those priorities that truly matter to us as a country. So what is expected of you? As we move through this process, as you engage in this conversation, I want you to understand and to appreciate that your nomination by your honorable commissioners, by your state, is a moral burden upon all of us to make sure that we serve our people meritoriously. It is our responsibility to apply ourselves through this learning and make sure that we get the most out of it so that we will be able to translate it into our plan that we will develop in 2026. It is with this that I want to welcome you and to ask you to please take on this responsibility, and I wish us the successful deliberation. And this year, we hope we will all come together to celebrate having a unified approach, a unified plan that is rational, realistic, pragmatic, and comprehensive, and for it to align with the budgets so that we better serve Nigerians. Thank you, and I wish you successful deliberations.